covering the skeletal system part 2. I want to remind you that skeletal system is made of axial skeleton and appendicular skeleton. And I already recorded another video that cover axial skeleton. I'm gonna put the link to that video in the description underneath this one. Okay, so let's go ahead and begin. We're gonna start with slide 3, where we can see actually these two divisions of the skeletal system. Axial shown here in greenish color that includes skull, thoracic cage, or rib cage, and vertebral column. Also, vertebral column includes sacrum and coccyx. And everything else that's shown here in yellow color are parts of appendicular skeleton. So this is the topic of today's lecture. That's why I'm gonna move down this PowerPoint. And this is where our appendicular skeleton starts. Now, I will go over the bones, but I will not cover them in great details. I'm not gonna cover landmarks and features of all the bones. I recorded separate videos that cover way more details of the appendicular skeleton. I don't want to include it in this video, otherwise it's going to be too long. And I do realize that my videos are getting longer, but I need to cover every slide on this PowerPoint. So I apologize for this lecture to be long, but I have to cover everything that is a requirement for this course. Okay, so appendicular skeleton includes bones of the limbs, that's your arms and legs, and their girdles. Pectoral girdle, shown over here, attaches the upper limbs to the body trunk. It's made of clavicle and scapula. Pelvic girdle secures the low limbs and attaches low limbs to the body trunk. Shown here in red is a hip bone or os coxa. And hip bone is made, two hip bones made pelvic girdles. So we have bones of the limbs and pectoral and pelvic girdles. Yeah, so here we can see clavicle. Clavicle connects to scapula through acromia clavicular joint. Clavicle, scapula. If you look at the clavicle, clavicle has acromial end. It's a lateral end that connects to scapula, and a sternal end, medial end, connects to sternum. Scapula over here has several landmarks. This is acromion, coracoid process, glenoid cavity. This is where we have joined with humerus, and humerus is the bone of your arm. And it has several fossa. Now, this is anterior view, and this fossa over here is called subscapular fossa. And I think on the next one we can see, yeah, that's a posterior view. You can see supraspinous fossa and infraspinous fossa, and this bony structure is called spine of the scapula. We're moving to humerus, anterior view, posterior view, head of the humerus, anatomical neck, surgical neck, greater tubercle, lesser tubercle, shaft, deltoid tuberosity, insertion of deltoid muscle. Distal end has several important structures: trochlea, capitulum. This is carotenoid fossa, and on the posterior side, olecranon fossa. This is humerus making connection with radius and ulna. And you can see capitulum articulates with head of radius, and trochlea articulates with ulna. This is a posterior view of your elbow joint. This is called olecranon of ulna. So this is your ulna bone, and it fits, olecranon fits in the olecranon fossa. Remember, that's a big fossa on the posterior view, that your olecranon fossa, and ulna has olecranon process. You can palpate this process. That's what you call your elbow. Radius and ulna. Now, radius is where your thumb, right? So if you're looking at your body in anatomical position, your thumb is lateral. So radius is lateral, and ulna is medial bone. Head of the radius is superficial, and head of the ulna, not superficial, sorry, it's called proximal, and head of ulna is distal. Between radius and ulna, you have a membrane called interosseous membrane. Now in the ulna, in the proximal side of the ulna, we have olecranon, we have trochlear notch, and carotenoid process. And radius and ulna interconnected in the proximal and in the distal sides, right? So here, distal end of radius and ulna at the wrist connection shown right here. So we have humerus, that's your arm, radius, ulna, your forearm, and then you have your wrist and your hand. Now, wrist is made of carpal bones. We have 8 carpal bones, and they're located in 2 rows. Proximal row, 4, so here's 1, 2, 3, 4 bones, and distal row also has 4, 1, 2, 3, 4 bones. Carpal bones articulate with radius. There is no really direct connection with ulna, because you have this structure made of collagen and cartilage between ulna and carpal bones. Now we need to know names for all these bones. So we're gonna start, this is the thumb. So in anatomical position, it's lateral. So we go from lateral to medial, and then we return back to the thumb, and we go again from the thumb to the little finger. A scaphoid, lunate, triquetrum, pisiform. Then we return back. This is thumb. The bone over here rhymes with thumb. Trapezium, trapezoid. Right in the middle, we have pretty big bone here. Capitate and hamate. And hamate has like this little hook over here. That's hamate, means a hammer. So you will be able to see those bones better during our lab practicums. Right, so again, scaphoid, lunate, triquetrum, pisiform, trapezium, trapezoid, capitate, and hamate. Then we move to metacarpal bones. They make your palm. Those are easy. Metacarpal bones, we just put MC, abbreviation MC for metacarpal, and we give them numbers. We start with thumb. MC1, 2, 3, 4, and 5, right? And then phalanges. Phalanges make your fingers. Your fingers have numbers too, and we always start with pollex or thumb. So 1, 2, 3, 4, and 5. So digits 2, 3, 4, and 5. All of them have 3 phalanges: proximal, middle, and distal. Pollex, or digit 1, has only 2 phalanges, proximal and distal, and the middle is not present, right? So that's your hand. Now we're moving to the low limbs, and we're gonna start with pelvic girdle. Now, pelvic girdle is made of hip bones. Hip bone or coxal bone or os coxa. So here's one hip bone. So that's a right hip bone, a left hip bone, and they connected posteriorly to sacrum, and anteriorly they connect to each other through this cartilage that's called pubic symphysis. It's a fibra cartilage. Now, hip bone is made of 3 regions. The biggest region here is ilium. Anteriorly, we have pubis, that's a pubis, and ischium. So it's ilium, ischium, pubis, right? So ilium, superior part, ischium, you're sitting on your ischium, and pubis is anterior part of the hip bone. So over here we have ilium, ischium, and pubis. Again, it's a lateral view, and they colored in a different color. So ilium, that's ischium, and pubis. This structure is called acetabulum, and acetabulum is a socket for your femur. So your thigh bone, femur, fits, head of the femur fits inside this acetabulum, and that's your hip joint. And you can see acetabulum has all 3 bones here connected to each other. Now this is called ischial tuberosity. You sit on the ischial tuberosity, ischial spine, greater sciatic notch, and some other like anterior superior iliac spine, anterior inferior iliac spine, ramus of the pubis, body of the pubis. Ramus is here and here, and body of the pubis. Next, we're moving down, and we have femur. Femur is the biggest bone in your body, anterior and posterior view. So we have head. So we have head, we have neck right there, greater trochanter, lesser trochanter, shaft, distal part, we have medial condyle and medial epicondyle on the top of it, lateral condyle. So here's the lateral condyle here. That's a medial condyle, and on the top of condyles, we have epicondyles. On anterior view, you can see patella surface. So here's your patella or kneecap. It fits within this patella surface. On the posterior side, you have intercondylar fossa. Now, patella or your kneecap has apex, and it has faucet, lateral faucet and medial faucet that fits inside the patella surface. Inferior, now your leg, inferior to femur, you have 2 bones. Tibia is the bigger bone, and it's medial, so that's on the medial side. And smaller bone is fibula. It's a lateral bone. So tibia and fibula. Between them, we have interosseous membrane. Tibial tuberosity is a bony structure just beneath your kneecap. You can palpate it as well. Distal part of tibia and fibula have malleolus. Medial malleolus is a part of tibia, and lateral malleolus part of fibula. Now femur, if you look over here, that's a femur. Femur articulates with tibia only, so it's a weight-bearing bone and no articulation with fibula. Now we move to ankle and foot. So your ankle and foot is made of tarsal bones, right? So here's our tarsal bones. We have carpal bones. Remember your wrist. We have 8 carpal bones. Here we have 7 tarsal bones. Calcaneus. So calcaneus is the biggest bone over here. That's your heel. Calcaneus is the name. On the top we have talus. Next to the talus we have navicular. So here's the talus right there. That's navicular. And cuboid. So cuboid is a lateral. So here's the lateral cuboid. That's your pinky right there. Then we have cuneiforms. So we have lateral cuneiform next to cuboid, intermediate cuneiform, and medial cuneiform. So that's our 7. Calcaneus, talus, navicular, cuboid, and lateral, intermediate, and medial cuneiforms. Here's the medial view. You see talus, navicular, and medial cuneiform. In the lateral view, you see calcaneus, talus, cuboid, navicular, and lateral cuneiform, and intermediate cuneiform. Then we're moving to metatarsals. Abbreviation is MT. MT1, MT2, MT3, MT4, and MT5. We start with hallux or big toe, and then phalanges. So digits 2, 3, 4, and 5, all of them have 3 phalanges: proximal, middle, and distal. And digit 1 or hallux has only proximal and distal phalanges. Comparison of male and female pelvis. Characteristic. Female pelvis is lighter, thinner, and smoother. Male is heavier, thicker, and more prominent, with more prominent markings. A pubic arch or pubic angle is actually this angle just below the pubic symphysis. In females, 80 to 90 degrees, in males, 50 or 60. So it's a sharper angle between 2 hip bones in males compared to females. So pubic arch shown over here, wider and more narrow, wider in females, more narrow in males. Acetabular is this part over here, smaller and further apart and larger and closer together in males. Sacrum, so that's a sacrum, wider, shorter in females. Sacral curvature is accentuated, and in the males is narrow, longer, and sacral promontory is more ventral. Coccyx is this part over here, more movable and straighter in female, less movable and curves ventrally. So ventral means towards the front in male. There is even more differences between male and female pelvis, but the easier one to remember is actually this pubic angle. So if it's 50-60 degrees, so it's pretty sharp angle, then it's male. If it's a wide pubic arch, a pubic angle, then it's female. Arches of the foot. Arches are maintained by interlocking foot bones, ligaments, and tendons. Arches allow the foot to bear weight. 3 arches shown over here, a lateral, longitudinal, medial longitudinal, and transverse. So because this is the pinky, if it's pinky, then it's a lateral part. Because medial it's towards the midline of your body. So here's our lateral longitudinal. On the other side, that's why it's shown here with a broken line, right? That's a medial longitudinal, and transverse is this arch over here. So 3 arches. And arches are formed by a tarsal and metatarsal bones. So let me see. And a couple more slides about developmental aspect. Fetal skull. Infant skull has more bones than the adult skull. Skull bones such as mandible and frontal bones are infused. At birth, skull bones are connected by fontanelles. Fontanelles are unossified. Sorry. Fontanelles are unossified remnants of fibrous membrane between fetal skull bones. 4 major fontanelles: anterior, posterior, mastoid, and sphenoid. Excuse me. So here we can see the superior view of fetal bone, and this is anterior part. So that's a frontal bone and parietal bones. And you can see instead of a suture, you have a membrane over here. You call it soft spot on the infant, but that's anterior fontanelle. So here's our anterior fontanelle again. Posterior fontanelle between the parietal bone and occipital bone. Mastoid fontanelle. This is where you have mastoid process, or mastoid process right behind your ear, and sphenoidal fontanelle. This is sphenoid bone, shown in pink color. Now, why do we need those fontanelles? Actually, it doesn't say here why you need fontanelles, but you need fontanelles. Well, first of all, at the beginning, during embryonic development, all these bones are made of membrane. So you don't have bone right away. You have skull made of membrane, and then membrane ossifies. You can see ossification center over here. And fontanelles are the last part of skull that became bone. And fontanelles are still present when baby is born, because it makes those bones of the skull movable. So you can squeeze a little bit of fetal skull when it passes through the birth canal. And it's also allow space for brain to grow. If somebody is born with bones that's already fused, then they would not have room for brain to expand. So that's the purpose of fontanelle. Development aspect, old age. Intervertebral disc. Remember, between each vertebra we have discs. They become thin, less hydrated, and less elastic. Risk of disc herniation increases. Loss of stature by several centimeters is common by age 55. Because, look, what it says, we get a little bit shorter when we get older, and that because those intervertebral discs become thin. And we have 24 discs, right, between each vertebra. If each one became a little bit thinner, of course, we can lose a few centimeters and get shorter. Costal cartilage, ribs are attached to sternum through costal cartilage. The costal cartilage ossify, causing the thorax to become rigid, and all bones lose mass. Yeah, so I guess when we get older, everything changes, and we need to learn how to deal with that and how to increase how to keep our body healthy even with the old age. Right? Okay. Anyway, this was the second part of the chapter, the skeletal system, part 2, and we cover appendicular skeleton. Okay, thank you so much for watching. I'm gonna link the previous video to this one. I'm gonna put that link in the description section for you to watch. And again, thank you for watching, and I hope it was helpful.